Hello, and thanks for choosing to listen to this webinar on stabilising cats with hypothyroidism, and in particular the sort of support that can help carers. My name's Sarah Caney. I'm a UK-based specialist in feline medicine, and I'm delighted to be talking to you about this really important topic. We're often very good at making a diagnosis in our clinics, but perhaps not always as good at following through with supporting our clients. And for chronic conditions like hypothyroidism, the education and the support of the clients is absolutely essential to a successful outcome. In my experience, many owners really appreciate being involved in all of the discussions, really appreciate being educated about the condition, and also will really appreciate access to resources that help to educate them on what's going on in their cat. And one such resource is my book, Caring for a Cat with Hypothyroidism, the cover of which is shown on the bottom right-hand side of this slide. When we speak to our owners, we want to tell them what hypothyroidism is and the impact it's having on their cat in a reassuring way, to tell them that this is something that we can manage. We can also explain what we expect treatment to achieve in terms of the cat's quality and length of life, and reassure them, I hope, as well in terms of the long term, that this is generally something that we can manage extremely effectively, very successfully for a very long period of time. We also need to explain to our owners what the treatment commitments are, because depending on what treatment they've elected for, there are of course requirements to come back for checkups. And I'm going to focus on medical management of hypothyroidism in this webinar. I think in an initial consultation discussing hypothyroidism, a really key starting point is always to reassure the owner that this is not their fault that their cat has developed this problem. In fact, we know still very little about the pathogenesis of hypothyroidism in terms of what is causing this condition. There are a number of things that have been cited, but at this stage, if an owner ever says to me, I've had a hypothyroid cat in the past, what can I do to prevent my current cats from developing this condition? I really will say there's nothing at this stage that I can tell you that you should do or that you should avoid, because we just don't know enough. So this is not in any way their fault that their cat has developed this condition. Going on from that, we need to educate our owners as to what the different treatment options are and what the advantages and potential disadvantages of each of those treatment options are. As I've already said, involving them in decision making I think is really important. For most of our clients, they really do love their cat very dearly. That's why they've brought their cat to us, and they want it as they would in their own healthcare or in healthcare involving a family member. They want to be fully involved and part of the decision-making process. And indeed, from my perspective, the owners are an integral part of the monitoring team. Treatment success, but they know their cat better than anyone else, and the information that they provide for me when monitoring patients is absolutely essential to a successful outcome. We also do need to speak to our owners about the practicalities, so how to give medication, the importance of compliance, because if we are using antithyroid medication, we know that if we stop it, the cat's hypothyroidism will return very quickly. Within 24 to 48 hours, the cat's T4 levels are going to be above the reference range. It's also important to educate owners when they need to be worried at home. So, for example, in a cat with hypothyroidism that is typically an elderly cat, one example I always say to owners is if they ever notice any problems with visual deficits, so the cat appearing to be blind, that always constitutes an emergency, because typically that is a cat with high blood pressure. And if we see it very quickly, we have a better chance of the cat maintaining some vision in the long term. Another important worry message for a cat owner would always be that if a cat is not eating for 2 or more days, then that again is an emergency. Complete loss of appetite for several days should always be acted on very quickly. And lastly, we need to explain why the checkups are important, which is to monitor treatment efficacy and also to look for side effects and the frequency of those checkups. So educational resources really help in our job with this, and there are a number of resources that you can access. So I've put a screenshot on the right-hand side of a very good website which DEKRA have designed, feline-hypothyroidism.co.uk, which is a very easy to navigate website that answers many of the frequently asked questions that a client might have about hypothyroidism. I also, of course, have my book on my website, vetprofessionals.com. ICAT Care, International Cat Care, also have an excellent website, icatcare.org, with information and advice on many conditions, including hypothyroidism, which your clients might find helpful. In a survey that I did of owners of hypothyroid cats a few years ago, one of the questions I asked was, what support would they have liked or have wanted more of? And as you can see, a lot of these owners really did want more support. About half of the owners thought receiving a book about hypothyroidism, such as the one I've written, would have been really helpful to understand their cat's condition and what they were dealing with. Those printed leaflets that often manufacturers provide for us to use in our clinics also make sure they don't languish in a drawer, that they are used, because again, almost half of the owners really value these and really wanted them. Google can be helpful, but of course you can also get bad information online, so being directed towards particular websites like the feline hypothyroidism one I've shown here, but also other websites that you're happy to recommend, I think is really helpful to make sure that your clients start with sensible, trusted websites that you know are not going to contradict anything that you've seen. And of course, discussion at the vet practice with the vet is always popular. I think owners can't get enough of our time, and this is something that we should know that is very valued, but also really helps our clients in terms of treatment compliance as well. They really value our advice and like to follow it where possible. Often we prescribe pills in our consulting rooms, and we don't always remember to talk to clients about how to administer a pill. So this is something that I do think we should pay more attention to, probably utilize the vet nurses in the clinic to give tutorials on giving pills to cats for those clients that have never had to do this. We should certainly not assume that our clients know how to give a pill. And we also need to make sure that our clients understand the dose that has been prescribed, that amount, and also at the frequency prescribed as well. The picture on the right-hand side shows a cat licking some butter off its nose, and I always like to tell my clients that it is scientifically proven that having a bit of butter on the tip of your nose helps a dry tablet or capsule go down into your stomach. And this is actually true. A study done in America, probably approaching 20 years ago now, gave dry capsules and dry tablets to cats and that were visible on X-ray, so they could monitor the cats fluoroscopically, and they found that sometimes those tablets and capsules stayed in the esophagus for hours and hours and hours, potentially causing local irritation, but also importantly not being absorbed, not having the intended effect on the cat, but just putting a blob of butter on the nose was enough to take them down into the stomach. So perhaps bear that in mind for medications that are acceptable to be given with food, such as antithyroid medication. We can talk the clients through the technique and little tips. So a tip I always pass on is that tipping the head back makes it easier to open the mouth. If you try and open a cat's mouth with it in a neutral position, they can potentially clench their jaws, but if you gently tip it back so the cat's nose is pointing to the ceiling, it actually gets pretty difficult for the cat to clench its jaw, much easier for us to open the mouth. Wrapping the cat in a towel or sitting the cat between your legs if you're on your own is often really helpful. Pill shooters I think also can be helpful if used gently, and there's a little video. I'll show that a little bit later on. And don't be afraid again to show the clients certain things, but also to direct them to appropriate resources. If the cat is receiving multiple medications, then sometimes it can be helpful to combine them into one empty gelatin capsule. So for those of you that have not used this previously, it might be a useful tip to get some empty gelatin capsules. They come in a variety of sizes, some that are definitely more dog-sized, and you can actually trim them as well. So you can open the capsule, trim the length and put them back to make it a smaller bullet if the medication it comfortably fits in. Of course, just check before you do that whatever medication you are giving is safe to be given in combination. Pill pockets, treats and paste, there are a number of these on the market and some of these can be extremely successful, so it's worth owners experimenting with these if they are unable to give the pill by mouth, for example, but also as a reward following pill administration. If we can make the pill administration seem like a positive part of the day, sometimes the cat will almost be asking for its medication in some situations. So I have a number of videos that I'd like to show you that are actually from owners. A while ago, through our website, we did a competition through the Vet Professionals website to ask for owners to send in a video of them giving their cat a pill to show us really what experience they had and what tips they had for other users. And in this first video, you're going to see Roz give her cat Susie a Filimazole tablet. In this next video, we're going to see Alison give Jeffrey his amlodipine tablets, and you'll see that Alison is sitting on the floor, kneeling on the floor, and using her legs as a barrier to Jeffrey, which I think many owners find is a useful way of restraining the cat at home for pill administration. And in this last video, Clarence the cat is having a variety of treatments. So he has a pill in a treat, and then a pill shooter is used to give his U-Move capsule, and I think is used very nicely and gently in the sort of way that we would want our clients to be using these. And then I think he's even having some meloxicam by syringe afterwards. So I've shown you some nice videos of clients giving pills to their cats, but overall I would say don't take just the word of those people, because this is actually something that larger surveys like my own paper that I mentioned and also some research conducted by DECRA has questioned owners about. And I've colour-coded the results on this slide to reflect those two different studies, but you can see that a lot of owners are reporting that they really don't find it a problem to give their cat a pill. So it perhaps is something that with appropriate tuition and appropriate support is much more achievable than perhaps many of us estimate might be the case with our clients. And in fact, the other advantage as well of giving the pill directly is also that confidence factor. So if the owner knows that they are giving the medication directly to the cat's mouth, they then can feel confident that the correct cat is getting the correct medication at the correct time point, which is clearly of much the way we would want it to be done as a clinician. What about hiding medication in food? Well, depending on the medication that you're using, this may be constituted as an off-license use of that medication. So you may need to discuss that with the carer. Thinking of antithyroid medications, in general, absorption of these is going to be enhanced by food. So that is potentially a positive impact of giving at the same time as food, but we need to also be consistent. So if, for example, your owner has been administering a tablet to the cat and you are assessing the cat and its thyroid hormone levels are still a little bit high and you decide to increase the dose, perhaps before increasing the dose you might want to ask them, well, are you giving this tablet with food? And perhaps if they're not, then continue to give the pill by mouth if that's working well, but offer the cat food immediately after to try and enhance that absorption, and maybe try that before increasing the dose of medication that's been prescribed. And ideally, of course, as I've already emphasised at least once, is making sure that the correct cat is getting all of its dose at that correct time, at the prescribed intervals. And giving medication in the food is certainly risking that not happening. If you can guarantee that your cat will eat that thyroid medication in that treat or in that small amount of food whilst you're standing watching it, then that's great. But if that's not happening, then of course we then have to question how much medication is being correctly received by that cat. And some DEKRA research of owners treating hypothyroidism with a liquid antithyroid medication showed at much lower levels of confidence when giving either a liquid or tablet, in fact, mixed with food. So dosing the food, definitely be careful to talk to owners about the potential downsides of that. Giving a pill by mouth, you have that certainty that the prescribed dose has been given to the correct cat at the right time. Pills, of course, can be spat out, so it is sensible to check, as in one of the videos, have a little look, see that the pill has been swallowed. Hiding a food, well, I think it can be successful in some instances, and again, that situation where the cat is guaranteed to eat all of that food or that treat whilst you're standing watching it, and you know that it's all gone in at that time, well, that might be very acceptable. However, if you are just putting the medication in the food and going off to work, there is a significant risk that the cat may not get the whole of their dose as they should do or at the correct time, or indeed that another animal in the household, or perhaps neighbour's cat that can get in through the cat flap, is in fact getting the medication. So we just need to be careful and make sure that everyone involved in the cat's care, the clinicians and the owner, is aware of how the medication is being given and whether there are any potential drawbacks. In summary, our carers definitely want and enjoy being involved in their cat's care, and they definitely, in my experience, want education about the condition and how they can help. They all want to help their cats. They want to, in general, do the best treatment, the most appropriate treatment for their cat, and we should ideally start our discussions with what our recommendations are and work from there. Work with the owner to make it practical for them as well as good for the cat. Hypothyroidism is a chronic disease, so for those cats on medical management, we're hopefully going to be managing them for many, many years. Bear in mind that things may change over that time period. Other illnesses may develop, so we do need to monitor these cats closely, not only from a hypothyroid perspective, but also from a concurrent disease perspective. And our owners are definitely going to benefit in those first few months from that incremental education that happens when they come in for a checkup. And of course, some of these checkups are very well done by nurses. Not everyone perhaps needs to be done by a vet, but it's that vet team that is educating the owner about the condition and how best they can manage it, what they can be looking out for at home as well. And all of our support, of course, should be individualised to that cat and owner to get the best possible outcome. Prognosis, just a reminder, often excellent. So here are some great cases of cats that have had a variety of treatments for their hypothyroidism and look in fantastic health, perhaps slightly too good health in the case of the ginger cat in the bottom right-hand side, but looking excellently after the management of their hypothyroidism. So it is often a good news diagnosis, even though I wouldn't wish any cat to have hypothyroidism. It is at least something we're often able to manage very, very well. And just to finish with some reminders of resources that I've mentioned and some that I haven't. So the screenshot on the left is my website with how to get to the helpful info, free downloads, various technical guides. There's a bulletin there that has some FAQs about hypothyroidism. There's my book, Caring for a Cat with Hypothyroidism, in the bookstore. There's the lovely Filimazole website, feline-hypothyroidism.co.uk, which is also written on the bottom left-hand side of the slide. A lovely Journal of Small Animal Practice paper on management of hypothyroidism, and also some nice guidelines from the American Association of Feline Practitioners that you might find interesting to refer to. So thank you very much for choosing to listen to this webinar. I hope you found it helpful.